I'm wondering if you see the fields of psychology, clinical psychology, therapy, you see these fields as uniquely vulnerable to being hijacked because of what a premium we place on empathy. You know, that's kind of the Carl Rogers mentality of empathy is like the number one thing that you can't do without. And you kind of have this mentality where it's like, well, people in the past have turned a blind eye to racism and misogyny and homophobia. You don't want to be like those people. You want to be on the right side of history. You want to care about people who are suffering and have compassion for the marginalized, this type of thing. And then kind of before you even realize it, you're promoting these bizarre, sadistic medical experiments on children. Like, do you feel like that need for empathy is part of what makes us vulnerable as a profession to being hijacked?
I believe so, and especially the way that you framed it. And that's how it's being framed to them as well. Okay, psychology in the past, or psychiatry, or any mental health area betrayed or neglected. These marginalized groups that you just mentioned. So we want to be better. We owe it to them. And so yes, and again, the empathy part. And it's not very empathetic when you are allowing people to do things that's harmful to them. That's not true empathy. But yes, I do believe that we are particularly susceptible to that. And that's why I was saying about the feminization of psychology, because, and when I say that, I want to be clear here. My podcast colleague, she's a woman, and she talks about the feminization as well. It's not literally saying about women, it's about this being overly agreeable, maybe not using as much logic as necessary.